So really what I want to talk about today is home-based VR, and just give you a couple tips. I want to make sure we have plenty of time to talk at the end and for all the rich discussion that's already occurring on the questions and answer. So essentially, home-based VR is taking and flipping what's currently happening with VR, which is most of the published literature is on the use of VR inside the hospital, directly with the patient, engaging with the procedure most often, or even within the hospital over a period of time. Our studies now, the most recent one we've just completed, and the one we're going to be doing with the NIH, is a home-based study where we're giving this to the patient, they're using it at home, and we're able to take on pain throughout the life as they're having it, which is very exciting and also leads to its own special challenges. Now, one challenge, given that we're giving this to home, which is great for this COVID era where we're quarantined, there is a special consideration. We get this asked quite often, which is what are your cleaning methods, or how have you adapted your cleaning methods within the era of COVID-19? And so our cleaning methods have always started with what I would call the wipe down. So wiping down first with a sandy wipes, which you'll see this all throughout your hospital. You do that pretty much every piece of material, cloth or the hard coverings of the actual headset. And then the alcohol-based swabs for the lenses, as that's more preferred for the lenses themselves so they don't deteriorate. And then we have also now added UV, as has Dr. Lewis and others. But even with UV, we have added in a tincture of time. So showing some of the correspondence that are out there about how long this virus can last on any given surface. We have usually 40 headsets or even more for our studies. And so all of our headsets have been in our office. We're kind of a hub of FedEx and VR equipment. And so we always have a tincture of time. So that helps with this era that we're in. There are colleagues that are doing studies. I know there's already questions about that. We can discuss that at the Q&A. So I won't get too far into all this. I really just want to talk about some tips to help you with your studies. I'll say for here that this is a 3-arm study. We do have a sham VR, which is important for our study to have a placebo to help show what the comparison is from non-immersive VR, so something like a 2D screen or a floating video screen of content versus a more immersive offering. Dr. Darnell already talked quite a bit about skills-based VR and the pioneering work in that area. So I'm going to leave that out for now. Also, our design, I've already talked a little bit about this, so the patients are getting this for a period of time. But what's also important on this, since we're talking about remote, is that we do have wearable devices, a Fitbit, which have been used in several publications in Dr. Spiegel's lab. And so we will continue to use that for caching activity. One thing to say about remote studies is even though we have physical sites to gain patients, the big addition for this study that we're going to be doing is Deep 6 AI. It's an AI system that searches through all the medical literature or medical notes within our system, allowing us to reach so many more patients than we could from any one clinic. And we're really excited to be able to implement that into our next study with the NIH. Just to let you know that we are connecting data also from the VR headset itself and from the Fitbit watch that we use, and we've already talked about that. So this page looks complicated, but I'm just going to sit on this page for literally a minute just to tell you what are the things that we've learned from doing home-based VR studies that I think could be helpful for you if you decide to do home-based programs for your institution. I think that for us, the parts that are very important is that the call itself, verifying the patient, which we've talked about with a little bit with Deep 6. That's a process of chart checking that shouldn't be any different from what you currently are. One thing I'll say about this is the physician, and connecting with the physician that patient has. And so we are sending out a note for each of our patients, letting their provider know, but we let the patient know that we are connecting and that this is something that we've thought would be of interest for you. And it's important to keep that relationship because patients do studies part to help them, but also because they've built this relationship with their provider, and we think that's also important. And so wanted to make note of that. I'm going to skip through some of these slides as I don't think they're as helpful. The call itself, when you go to remote, the downside to going to remote is, of course, you're detaching yourself from the patient physically. So the important thing about this call is being able to provide all the information you can and doing it in a way that allows the patient to feel comfortable about it, answering all of our questions, and just really making time, knowing that that call may take a bit more time. And I want to just say, one thing we've learned is with LA, classically, we have traffic. And it's actually a great time to talk to patients when they're coming home from work about a study that they might be a benefit to them, connecting it to potentially their doctor that they're working with, and helping to really cause that engagement. So there's some amount of tips to kind of engaging with patients remotely, as you won't be doing face-to-face. If you want to do video visits, that might be something you may want to have a video call, although I don't recommend that while they're driving. We use electronic consenting, although I think that's something that's been evolving over time anyways. One thing we do recommend is a screener week. One thing many patients may do is when they come into a study, they may not totally, their lives can be so busy that they may have signed up for something that they didn't really know they were going to be getting into. And so we do have a week where we try to assess some of the amount of their baseline data, and then see if they're still interested in being in the study. And we just think this is helpful for kind of connecting to the patients that really want to be in the clinical trial. FedEx tracking, all I'm going to say on this is that to some degree, when you start doing remote, you're going to start feeling like you're heading into a FedEx center. And so just always keep that information, automate as much as you can related to the FedEx tracker. If you want to reach out to us, we'd be happy to chat about how we do automation using Python or other code to automate that process. Know that just with any research, there can be mistakes. And so we do have mailing things out. We have had 1 or 2 devices actually crushed for unknown reasons. 1 or 2 out of 250 is a pretty good odds, or not too bad for having that type of issue. So always with research, just be flexible as best you can. And so with that, I think I'm going to leave it at that, and would rather get to discussions. If you have questions about how many reminders to set, how many texts to set, we can chat about it in that discussion.